Hello, and welcome to the Embrace Balance, Discover Joy podcast. I'm Amanda Butland, your host and intuitive life coach. Welcome to another episode of the Embrace Balance, Discover Joy podcast. Today, my special guest is Dr. Heather Stanley. Heather, so great for you to be with me today.
Same to be here. Thank you for inviting me, Amanda.
Yeah, so I'm excited to get started today. But before we get started, I'm going to ask you my icebreaker question. Would you mind sharing with us what activity or hobby brings you the most joy and why?
Lately, it's been tennis. It's nice to whack a ball, especially after a stressful day. Something about that is therapeutic. My other hobbies had included traveling, but post 2020, that has unfortunately taken a sidebar. So I would say right now it's tennis. Um, it used to be reading, but after so much reading, I just kind of like to relax and tootle around the house and spend time with my dogs and play tennis.
Oh, I love that. Tennis. It's an activity that, I did actually enjoy at some point in time, and then now I'm like, I don't really, that seems too much work for me now. But I love that
Yeah,
you're into it.
yeah, it's true. And I find that with time, and actually because I'm not as consistent with it as I used to be, which that's going to change shortly. Um, it's it's kind of like if you don't use it, you lose it. It's not like
Hmm.
riding a bicycle. And
Hmm.
so, but the muscle memory is still there. And I find myself kind of chasing after a ball, which kind of reminds me of the persistence that I should not lose in this very difficult year. So it's a nice hobby.
Yeah, yeah, for sure. It's, physical
Yeah.
activity is always good. It's great. And it's outdoors too. So it's all
Yes,
good
it
stuff.
is. Yeah, it is. Yeah.
All right. Well, we're here to talk about coaching. And I would love if you wouldn't mind sharing with us your journey on how you got to where you are today.
So in a nutshell, from I can remember as a child, I was always really curious about what made the human body tick and why we did what we did. It started off physically. And as I pursued that dream, became a doctor, went to med school, did all the things necessary for that, and got into the business of interacting with people, trying to understand people. The mind, you know, I was very curious, but felt unprepared for that mindset part that became quickly very evident that that was a big part of taking care of the physical body. And so over my years of training and actually hardcore experience, I am a maternal fetal medicine specialist by training, and it often involves a lot of difficulties, not only with mother, but sometimes with the baby, and trying to navigate a parents through that sometimes difficult information and decisions and planning. After you go through the diagnostic and the interpretation and the prognosis and the natural history and all of that stuff, I found there was a big gap. I'm like, okay, those are the facts. How do I help them deal with the devastation? And so over time, I was kind of more into that. Then I started asking myself, how could we implement a preventative way rather than trying to fix a problem after the problem's there. And so lately, I have been focusing on preconceptual counseling, and then it involves women who may be having difficulty getting pregnant or maintaining a pregnancy. And the mindset, the coaching aspect of it has been, it's an area that nobody really, I feel, it's been ignored. And so here I am trying to brave the frontier of that part.
Mm. Well, thank you
Yeah.
for sharing your journey. I love how you sort of brought together, right, sort of the mental aspect of physical challenges and how such a large part that plays, because oftentimes, people aren't really thinking about that part of it, right? Like you go to a doctor, you think there's something wrong with your body, not realizing like there is probably something else that might be contributing to that, in the mind. And I love how you're bringing those two things together in what you're doing today.
Thank you.
Yeah.
I've seen where addressing the whole being it's so important, and we cannot disconnect our head from our heart no more than we can disconnect our brain from the mobility of our extremities.
Mm-hmm. Mm-hmm.
So,
Yeah.
yeah.
Yeah, so I would love to learn a little bit more about, how you're able to coach through, um, sort of the process that you help people through, because it is a challenging time when somebody isn't able to get pregnant or isn't able to maintain a pregnancy. That I'm sure, especially over time, could take huge toll on a woman's, and even the father probably, because they're together
Yes.
trying to create a child. And is it the woman that you're focusing on? Do you also coach, the fathers, or the trying to be fathers, or is your focus really on the women? I'm curious about your focus on who it is that you're working with.
So my focus is really on the family unit. So as I
Okay.
said, I did not start off as a coach. It was more of we're here together, mom and dad, sometimes, future grandparents. And so in the brick and mortar office, trying to give them explanations, scientific explanations as to why a thing isn't happening. And with that visit, what I found myself drawn towards was the dynamic, the personality dynamic, the energy dynamic, the trying to answer the intangible questions.
Mm.
And from there, it took seed within me. And so it's a case by case patient basis. I've had everybody from very focused minded couples who, one patient 14 pregnancies later had her baby
Wow.
because you were not going to tell her. If I told her fly to the moon on a firecracker, she was going to ask me, which brand is better, firecracker A or firecracker B? To the patient who was so paralyzed by her fear that we ended up creating a special process or a special routine from the time she stepped into the office until the time she sat on the ultrasound table to the moment I had to put a probe on her belly for her to hear the baby's heartbeat or not. And for
Mm.
that particular patient, it was complete silence. Don't try to tut or touch or, oh, it's going to be okay. None of that. Her hands were on our eyes, and so over time we just kind of developed our little routine.
Mm.
She went home with her baby. She had promised me a dance. I'm still waiting for the dance, but I'm going to get the dance in another way. So it's just really meeting the patient or the client where they are. Sometimes women aren't ready. Sometimes it's a male factor, and to have to break that to them. So it's just, I don't know, it's just in the moment.
Yeah.
I wing it and see what happens. And after a few years, I was like, I do more coaching than I'm really doing consultation, because I can tell you, yeah, this is the diagnosis, this is the prognosis, this is the that. But then there's this really awful, pun intended, pregnant gap. Okay, this is the thing. What next? And why? And how do I cope? How do we cope? What do we do? And I just started trying to fill it to the best of my abilities.
Yeah, I love. Yeah, no, I love that so much of what you do involves the coaching piece, because you think, when you think of people trying to get pregnant, you think it's very technical and physical. You don't really necessarily think about the mental aspect and the coaching required to help navigate people through the process. I love what you mentioned, some of the examples that you provided around the different types of processes or clients that you have, and how you meet them where they are to suit them for their what they're going through, and providing a solution or process that works best for them. And I love also what you mentioned around treating the family as a unit and not just an individual, because you're right, there's not one person involved in this process. And I love that you even mentioned grandparents as well, and how they get involved in the process as well, because it's a family affair. So I love that piece of what you do and how you bring that all together.
Yes, I will tell you, it was overwhelming the first time. I had 4 generations in this teeny tiny ultrasound room. And, they're all coming with their different energies of concern and happiness and fear and hope and excitement. And, you know, in our medical OCD space, we like quiet, we are trying to figure things out, we like things in a certain prescribed way, and the chatter of, two parents, two sets of grandparents, a great grandmother up in there. I had to learn to flex really quickly, and at the end of the day, it was fun. It was fun for me because I realized, just for me personally, how much I kind of miss that family aspect of things, and to just absorb that love in whatever state that they have it. So after I got off over my initial kind of like, okay, I had to tell them, I was like, okay, people, doc really do, I need at least, I put the probe down. Is the heart fine? Is the baby this? Da, 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 da. Like, all right, time out. But within that, it taught me a lot about myself. As a very OCD person, I needed to just bend and flex and accommodate. So it was all good all the way around. But yeah, it's good to see that families are coming together, and I love that.
Yeah, yeah. It's funny when you mention like how many people are in the room with you. I can imagine how cramped that must be, but also like what a great opportunity for like group coaching opportunities for, right? It's because you're not
It,
coaching an individual, you are coaching a group. And so how different that is when you think of typical coaching where it is a one-on-one situation, but to be and doing it in a group setting like that.
yes, yes, it is. It is. It is. It was fun. And there's, if this were to recur, which I think it will, because actually today I had one and it was by a virtual, so that was a little better, but there were three generations in the room again. This was a different
Wow.
situation, little, prognosis uncertain, um, but still with that, the fullness that I get in helping that entire family navigate
Mm.
this incredibly difficult journey, and to see that there is a unique solution. Now, the solution may not be the solution that they're hoping for, but in preparing them, they now can they have been empowered, I hope, to sit down. My favorite thing is to tell them, okay, so when you go home now, you're going to have lots of pillow talks because I've given you some things, opened up some things for you to sit down and talk about. And so they're aware, their hope is still intact, but with a practical and sober element threaded in it.
Mm.
Yeah. And in that moment at the end of the thing, I was like, okay. And I said to them, I said, we've done everything that we can do. No stone has been left unturned. You're now prepared for your next step. And I sent them the questions that we put together. So, I would say it was more coaching than consultation.
Mm.
And that is something we can talk about, the difference between coaching and consultation, because I'm
Yeah,
learning a lot about that.
yeah. Let's talk about that a little bit because it is very different because the coaching process is very not right. It's not consultation at all. So do you want to maybe talk a little bit more about really that difference between consultation versus coaching?
I can share with you my learning curve on that. I don't feel like I am qualified to say, well, I can tell you consultation is you come to me and you ask for an opinion about a specific condition, and I tell you what the condition is. I confirm or refute that condition. We talk about the possibilities of what other things might be that could cause what we're seeing or what we're experiencing. And then we talk about maybe the natural history, treatment options, alternatives, and referrals, etc. Coaching is, in that context, is helping the couple, or well, usually it's a couple when I'm doing that because I start there and then expand to the family, because really the agreement is between the patient and not even her partner technically, but they're included. But it is very clear, I tell them that she is the one. She will have to now take this and advocate or petition or come to some kind of mediation with you, the partner. But I'm going to bring in the coaching, your views, and whatnot. Because, like something as hard as having to terminate for a lethal condition.
Mm.
And it's interesting how couples even learn about themselves in that moment.
Mm.
Yeah. So the coaching part is for me, helping them identify things that they should consider in an open-ended question, and, just kind of opening the door a little bit, and then inviting them and encouraging them to go in that door and deal with it soonish. That's the difference between coaching and coaching under circumstances like this. I'm like, y'all don't have all year. Okay. Y'all got 3 weeks, or you have 2 weeks, or you have a month. So it's really time-based coaching.
So yes,
Yeah.
it is a little bit different in your
Yeah.
context.
It's a lot of different. Yes.
All
So
right. Yeah, it is. Yeah, I like that you sort of described that, because, it's good to sort of see how that actually works in your practice. It's not something I would have, been able to figure out probably on my own. So I like that you described that. So thank you. Um, I did want to touch back on one thing you said a little bit earlier, and it was around sort of the growth and the learning that you get from interacting with your clients. Because I feel like, as coaches, we're there to help support and our clients and help them grow and elevate themselves. But oftentimes we learn things from our clients, and there are lessons to be learned there. I would love to talk about that a little bit, because I think that that's not always something that clients know, that they do actually have an impact on us too. It is sort of a two-way street. It's not all one directional.
it is. It is. How, in what aspect? I mean, for me, there's so many facets of that. I mean, it
Just
kind of
pick
comes
one.
back.
Pick whatever,
um,
say whatever you want.
okay, all right. So, I would have to say culturally. So I was born and raised Jamaican. My mother, well, I mean, my father too, he was like the silent of the silent generation, but he was silent, but um different than my mother, who was the silent generation. You should be seen and not heard.
Mm,
You should not have an opinion. You should serve and don't ask for any appreciation. And so, with that in mind, that was the foundation of my upbringing as a
mm,
child. Um, Coming into the sphere of helping people, having to work with their personalities, their their own issues and biases and whatnot. And I had to develop my emotional quotient really quickly.
mm,
And it took a while. And then, of course, I'm an immigrant. So I came from a different country. I was born and raised in Jamaica, where, you know, culturally, the lifestyle is different. Things are not as strange as they are here. We've had a female president already. Our presidents look like us. So things like that were, we didn't even think about things like that. And then you come to a different space, and then, you know, things are different. So I had to learn to literally part that, all of what that comes with whenever I'm in the space with different folks. And the one thing that I actually did learn is that when people figure out that they're here and they're being helped, all that secondary stuff doesn't come in.
mm,
It doesn't come in, because once we start talking about the business of what's going on with their pregnancy or future fertility. For the most part, of course, you have the exceptions. And I have learned that, people come with their own experiences. I didn't always know that. And so in listening to them, I was learning.
Mm.
And sometimes listening to them, they were reflecting back to me how they were perceiving me.
Mm.
And on occasion, I'd have to because I would go in, for example, if my energy was tired, I would not be present. I mean, I was there, I was listening, but my active listening skills were very dependent on the mood I was in.
Mm.
And so I've learned to park all that aside, do a mind shift set myself, give myself permission to be actually human and not perfect.
Mm.
So yeah, that is, I think, the biggest thing.
Mm. I love that what you just said there about giving yourself permission to not be perfect because not nobody's perfect. I don't even know what perfect necessarily means. Everybody's unique, right? That's the good thing or the perfect thing about the planet is everybody's unique. There is no one standard, right? Everybody's perfect in their own way. Well, how about we say it
Yes.
that way?
Well, if that were my late mother, I love her to death, but perfection was the goal, and that was what was entrenched into my young mind. And then I realized as you get older, because when you're in your teens and your 20s, you're dumb. You're young and dumb. You don't really know. You think you know, but you don't. So I've learned over time that, yeah, she did the best she could for what she knew and how she knew.
Mm.
I had to just quiet her voice in my head
Mm.
and tell her, it's time to let me do my thing now.
Mm. Mhm.
And when I was
Yeah.
able to do that, it's been interesting.
Yes, absolutely. Yes. I like what you just said there. And we're a little bit off topic, but it's okay. But that, all parents do the best they do with the skills that they have in the situation that they're in. I don't think any parent has really negative intentions for their children. They want the best. It's just the way it comes across. Sometimes I think you're like, whoa. And then as you age or become a parent yourself, you're like, okay, now I know not necessarily what to do in that situation and what you've learned from sort of your own being parented experience.
Mhm.
But yeah, I think everybody does the best that they can. And as the kids that might have experienced maybe not the ideal parenting situation that they would have hoped for, that they learn from that and they grow from that.
Yes.
And then that's why every generation that comes next is always going to be better than the one before.
Yes, we hope we learn and grow from it.
Yeah.
And that is the challenge.
Yeah.
That is a challenge.
All right. Well, this has been such an amazing conversation. I've loved chatting with you and learning more about what you do and your practice. And before we wrap up, I would love to open it up for any last parting words you would like to share with our audience today. Any special message to go out today?
Oh, well, I will share with you what I am trying to do myself is do it anyway. Don't be afraid. Well, no, I'll take that back. You're going to be afraid. I mean, not being afraid telling people not to be afraid is kind of a little bit of a lie. I've heard various iterations of the definition of the word courage, and it's not it's being afraid, but taking that step anyway.
Mm.
And 3 years ago, if anybody had talked to my younger self 3 years ago, that I would be doing this at 11:30 at night, speaking off the cuff from the heart, sharing my business, my heart business, that is, the deep, dark secrets that my mother said, don't you air your dirty laundry out for all the world to hear. I would say I would not be here. But here I am. I'm, I'm a senior and I feel younger every time I do something that is way outside my comfort zone.
Mm.
I started taking ice baths. Yeah.
Wow.
I'm a Jamaican. Anything under 70 is cold. But I did it.
That is awesome. I love that. Yes,
So do it
absolutely.
anyway.
You got to do
Do
it
your
anyway. You
thing.
got to
Yeah,
absolutely get outside your comfort zone, try something
and
different, stretch yourself, and
that's
grow.
right. Yeah, just a little tiny step.
Awesome.
That's my parking message.
Awesome. Well, thank you so much. And thanks again for being with me today. It's been a pleasure, Dr. Heather. I invite you to subscribe to the Embrace Balance Discover Joy podcast and join our community. If you feel inspired by what you hear, please leave a review and share this podcast with others who might benefit. And remember, it's never too late to embrace balance and discover joy in your life. Stay tuned for our upcoming episodes filled with inspiring stories and valuable insights. Until next time, take care and be kind to yourself.